Thank you for joining me. I'm fortunate indeed to be joined by Ron Pollack, the Executive Director of Families USA. Ron's an expert in healthcare consumer policy, and he oversees Family USA's mission of achieving quality and affordable health coverage for everyone in our country. So our topic today is the Affordable Care Act and open enrollment. There's been, as everybody knows, vigorous debate over healthcare reform all across this country. Healthcare affects all of us and our families, and it's important to understand how the law will affect each of us. Unfortunately, there's been some misinformation. So today we are going to talk specifically about how the law affects us and how you can sign up for coverage. So now let's start with 4 questions, and I'll read the first one, Ron. Can you talk a bit about the website? There's been so much discussion about it, and whether and how it's improved, and what you think the future really is likely to be like.
Well, glad to answer that question. Obviously, there were some difficulties with the website in the first 2 months, in October and November. But there have been very significant improvements, and almost all the glitches, not every single one, but almost all the glitches have been worked out. And all the reports we are getting, and now covered in the news around the country, is that the website is working much better. The thing to really remember is that there are still 4 months left in the enrollment period. This is a 6-month first enrollment period. So we've got 4 months to get people enrolled, and I think we are going to get many people covered. The inquiries that have been made about, that have gone to the website and phone calls is extraordinary. 29 million people have called in or have gone to the website to try and get information. Another 5 million have made phone calls. So this shows there's a lot of interest. Now that people can get enrolled, I think
it was a surprise, I think, at first, so many. And even if it were working well, it might have been overloaded. Clearly, there were problems.
Yes.
But now you think the vast majority can do this?
Yes. I think all of the feedback we are getting is that the overwhelming majority of people who are trying to get into the website and to get enrolled are able to do so. So it's a vast improvement.
Okay, so let's talk a bit about what benefits have accrued to consumers not directly related to their going into the website. What's been happening all these months and months since we passed the law? How have consumers benefited? You've been working on this so much. Give some data so we all understand the benefits already accruing.
So there have been some benefits prior to the big new benefits that'll go into effect on January 1. But some of the things that people have already been getting, for young adults, who are not yet 26 years of age, they can stay on their parents' policy, and millions of young adults have already done so. Children who have pre-existing conditions like asthma or diabetes, who before were turned down for insurance coverage by insurers, they no longer can be denied coverage. And that's a prelude to this is ultimately going to be extended to everyone, to adults.
And that's already affected hundreds of thousands, right? Hundreds of thousands.
Yes, I mean,
in the state of Michigan and elsewhere, it's been a considerable impact.
No question. In terms of children with pre-existing conditions, things like asthma and diabetes, we're really actually talking about millions of children. And so now insurers cannot deny them coverage. Come January 1, they can't deny their parents coverage, and they can't charge a discriminatory premium based on health status. They can't terminate coverage when somebody gets sick. Women will no longer be charged a discriminatory premium, especially women of childbearing age. Seniors have already gotten benefits from the Affordable Care Act.
First, before we talk about that, I think there needs to be an understanding that up till now, the insurance industry, the insurance carrier, has been able to differentiate, to discriminate. And you know, the irony is that a good portion of healthcare reform relies on private insurance. Some people have said it's socialized medicine. In many respects, it's the opposite. It's reliance on the private insurance industry with the requirement, though, that they not discriminate, right? That they not preclude people who have a pre-existing condition. Or if they develop one, they can no longer be able, children right now, say no more insurance.
That's right.
So there's an effort to rely on the private insurance market, but to make sure that it works for everybody. Does that sum up what's really happening?
Absolutely. So we are relying largely on private insurance companies. We are keeping this in the private sector, but the private sector companies that are going to benefit significantly because they can now get more clients who sign up for insurance, they have to follow the rules. They've got to be good corporate citizens. And so they can't terminate someone just when they get sick. Somebody's been paying premiums all along, they get sick, and then all of a sudden they're yanked off their insurance. And there are between 60 and 70 million people under 65 years of age who have a significant pre-existing condition. Those folks now are protected. And this actually even helps people who have employer-sponsored insurance, because people today who have employer-sponsored insurance, they can get coverage even if they're sick or have a chronic condition. But if they want to leave the job or they want to start their own business, they're terribly worried, because if they leave the job, all of a sudden they have to buy insurance on their own, and if they have a pre-existing condition, they can't get it. So even people who have insurance today, who have a pre-existing condition, this provides peace of mind.
That's so important. Well, let's go on, because I had so many questions, and I'd like to try another one. I think we have time. Let's talk about people signing up and how your organization is involved and how there are navigators. I think that's a new term in this area. So tell us about signing up, the role that you play, and the role that others are playing.
So the most important thing that we understand needs to be done is there are still huge numbers of people who would significantly benefit from the Affordable Care Act, who will get significant subsidies that will make premiums affordable for the first time, but they don't know about it. And so we've got to make sure people know about this. And by the way, these subsidies, for a family of four, if you have income up to $94,200 a year, or you're an individual living alone with income below $46,000, you can get these subsidies. And these subsidies average for family coverage over $5,000 a year. So job one is to make sure we help people understand what they can get out of this. But then, as your question infers, then we got to help people get enrolled. And that's what these so-called navigators are intended to do. A lot of people have never had the experience of buying insurance. You know, they were denied insurance because of a pre-existing condition. It was too costly. They couldn't read the fine print. So they need to depend on some people to give them information so they can make choices about the plan that's best for their family, and they can apply for these subsidies that will make coverage affordable. So we are working closely with these navigators to help make sure that they are proficient in providing help to people. And with that help, I think we're going to get many millions of people enrolled.
Okay, you know, I like always to refer to a mailbag, questions that come in. And the first question related to this from a constituent in Bloomfield Hills. I know if it's Bloomfield Township, I represent that area. It's a little complicated. And she was trying for 2 weeks to get health care coverage. In a sense, we've covered that. Your suggestion is now it should be easier, and there are also places to call. and to get help through the telephone. And so I think people who want to can call our office, 586-498-7122. So I think for the person who called from Bloomfield, that's the answer.
Keep on trying.
And it's now much easier, is
That's
it
right.
not? And let me just close, I guess, with a question I'm often asked, because there's a feeling that we in Congress have something very different. Up till now, for myself, my late wife, we had insurance like every other federal employee. Now, members of Congress and some of the staff, it depends on their exact position, need not to, we can't use that. We have to go through the exchange. So that's, I'm going to be covered through the exchange, and I'm going to get my pick of plans through the exchange. So I think everybody has to understand, in a sense, that we're all now in this new structure. It's a structure that has been tailored to respond to our needs. It did not start perfectly. And for some, there'll be some change. But we decided to rely on the private sector except for those who go in expanded Medicaid. And we really need to understand that the private insurance system for healthcare is complicated, as is true for auto insurance, and even more so. And we all need to now access the opportunities and to see what's best for us. I mean, that's what your organization is all about, isn't it?
Yes, it is. But, you know, one of the things that I think is really important for your viewers to understand is those people who have private insurance today, an individual insurance policy, the vast majority of them are now going to be eligible for subsidies. Almost 3 out of 4 people who now have individual coverage, 71%, it's not quite 3 out of 4, are eligible for subsidies. And so it's important for your constituents to make sure that they inquire about the subsidies they will be eligible for, because this is something that never existed before. This is going to be a big deal. And then on the point that, you know, that you're essentially making, the fact that members of Congress are going to be in the same system, I think should give confidence to people. You know, what's good for the goose is good for the gander, and I think constituents can feel that if members of Congress have said, we're going to live with it, well then probably they'll feel good about living with it as well.
No, we won't be eligible to subsidies, and I want to close with that. The reason that there are these tax provisions called subsidies by some, tax credits, is because people who don't have insurance, a number of things happen. They go to emergency rooms and all of us pay for it. Or they don't get the preventive care that they should. And then they essentially need health care when they're sicker. That's bad for them, and it's really bad for all of us. They're sicker, they have no insurance, they go into an emergency room, and then they have to have very expensive health care. So I hope this experiment, I think it's going to work. It's working better technically, and I think if we all keep working at it, when we look back, we're going to say it was better. This was the only country that had 50 million uninsured people and who had insurance coverage that could be eliminated at the whim of the insurance industry. That's no longer true. I congratulate you on Families USA.
No, I congratulate you. You've been a leader in important Ways and Means Committee, and we're deeply thankful for the wonderful work you have done.
Well, families, that's what really matters. We'll keep working on Families USA.
Well, thanks
Thanks for joining us, Ron.
Thank you.
Thank you.